Hi, I'm David Levine. I'm co-chairman of Science Writers in New York. I'm going to wait a few minutes to let people get in the room because we have a lot of people signed up and they have to log in. I want to thank, as always, my co-chair, Joseph Bonner, who is behind the scenes. You can't see him, but he's recording this, and he will also be putting it on YouTube. So I'm going to start with I'm going to introduce our guest, and so our guest is an award-winning investigative journalist, Gerald Posner. His latest book, Pharma, Greed's Lies and the Poisoning of America, is being turned into a 6-part series on Showtime that will air later this week. I'm sorry, this year, probably in the fall. And he was also a consultant to the Hulu series Dopesick, which tells the story of the Sacklers, who I'm sure we're going to touch on today. So our topic tonight is the opioid crisis in America. And it's really a worldwide crisis. More than 1,500 people per week die from opioid-related overdoses. The toll that has spiked across the country amid the COVID-19 pandemic. Meanwhile, millions more Americans suffer from opioid addiction. In New York, this is in New York. In 2020, opioid overdose deaths increased 38% nationally and 44% in New York, according to provisional courts. The share of drug overdoses in New York involving opioids increased 85% in both 2020 and 2021, from 69% in 2010. In 2021, 30 New Yorkers per 100,000 died from drug overdoses. 25 per 100,000 New Yorkers died from opioid overdoses in that year, compared to 5 in 210. New York's opioid overdose death rates exceeded national rates in both 2020 and 2021, which is not a number to be proud of. So opioids, have been a lot in the news. Gerald, I talked before this, and it seems that opioid is moving towards prescription. It started out as being overprescribed, and now there's a lot of scrutiny, and so now people are getting it illegally, and mainly through fentanyl, which is one of the leading causes of death. So can you just kind of give us an overview of what's going on in the last 10 years?
Yeah, I mean, David, it's grim. The statistics you just gave. It's hard for me to imagine if you were in a coma and somebody woke up after 10 years and heard the stats you were giving. They would have no idea it was 2023. They would think it had to be better by now, because it's been such a problem for so long, and it continues to get worse. And you're right, it started off, the fire was lit by OxyContin and the Sackler family in Purdue. They fanned it, and then a lot of other people sort of sat on the sidelines and allowed it to happen. Some joined in to make the profit. So it was a prescription drug crisis, killing people for a long time. And then there was diversion from the legal supply to the streets. And sometimes, back even in the early 2000s, there were clear instances in which people were stopping OxyContin because they were able to buy heroin cheaper on the street and continue a habit. So there was always a diversion to the illegal market. But now, once the crackdown finally took place, and I do mean finally, it's a long time coming in terms of the prescribing, made it very, very strict. A lot of doctors have trouble giving out even opioids, sometimes for people who really need chronic pain. It's caused an explosion in the illegal market, especially with the flood of cheap fentanyl synthetic product that just continues to come into the market and is widespread. So it's as bad as it was, I think, a decade ago when I was looking at this initially. I think it's almost worse in some ways now because it's harder to get your hands around it, since so much of it isn't legal. You're back into the illegal drug market largely.
What are people who are using it illegally? What's their main use? Is it for pain, or is it recreational? What are they using it for?
Look, some people who are dying after a single fentanyl dose are using it recreationally, sometimes for the very first time. That happened with OxyContin in rare cases as well. But there's no doubt there's a recreational use that tends to be Gen Z or younger kids mostly. Older users who are trying to get fentanyl are using it for what it's used for legally. I mean, fentanyl has a legitimate use. It's a powerful anesthetic. It's used for pain relief in hospitals after surgeries. It is, given to people that leave a hospital and don't have any bad effects later, nor are they craving opioids necessarily. So that in the right setting, it can be all right. But at the street level, it's often being used to self-medicate. People are taking it for chronic pain situations that aren't approved. Look at even opioids, long time release opioids like OxyContin and short relief pills like Percocet were never approved for osteoarthritis. Yet I know still of individuals who take it for very, very painful osteoarthritis, for bad back pain, for injuries they've had in a car accident and that wouldn't be prescribed by a normal doctor. So I think there's a lot of self-medication taking place as well.
Do you think there's anything wrong with that?
Yeah, well, what's wrong with it is with fentanyl, you don't know what you're getting. If you get a 20 milligram or 40 milligram a pill of OxyContin, doctors told you to take it. That may not be the best advice because you might be taking a dosage that's going to lead to an addiction much sooner than the drug rep for the company had told the doctor and the doctor's aware of. That happened, and I think it's one of the reasons that the addiction boom took place. But with fentanyl, you're buying something on the street. We have reports now that have been proven that in the drug testing, the DEA is finding fentanyl mixed on the street with xylazine. For a lot of your cohorts and colleagues and the science writers will be familiar that that's a horse tranquilizer. It's not meant for humans. It cuts the fentanyl down, sort of extends the duration of it, but can add to how lethal it is because it's also a respiratory suppressant. So, depending on what your condition is, you have asthma, you've already had a problem with breathing issues. That's why it's a roll of the dice on the street when you self-medicate. It's so dangerous.
Okay. And it's, you also talked about it's supplied mostly by foreign-based drug cartels. So where is this coming from? We all watched Breaking Bad. So yeah.
I think the tunnels that we saw in Breaking Bad that looked like they were, sort of a luxury basement in a Four Seasons hotel, or that there are probably quite a few of those underneath the border. I always thought when the last administration was talking about building a wall, the wall isn't the problem in keeping the drugs out. Those drugs are coming in underground in tunnels that would shock people in terms of how sophisticated they are, and they are well lit and they are mechanized. That aside, get the right bunch of chemicals and you're in an area where it's not too smelly, you can come up and make fentanyl. Somebody could make fentanyl without a great deal of chemistry knowledge. The reason we don't have more homegrown fentanyl manufacturers or dealers in that sense is that the Mexican cartels make it in bulk. They're almost impossible to beat. This is a cold calculus to beat for price. They flood the cities. They have it coming in such a large amount, and then they use U.S. gangs and others to distribute it. But it's pervasive in the U.S. and this is the problem. The war on drugs has largely failed since it's been declared by Richard Nixon, and I don't think we can arrest our way out of the fentanyl crisis. I don't have an easy answer for it. There wasn't an easy answer for the opioid crisis, which is now morphed into becoming the fentanyl crisis. But the problem is that enforcing our way out of it isn't going to be an easy thing to do.
So someone asked that very question. Is the fentanyl crisis tied to the opioid crisis?
I think it's the successor. It's the follow-up to what had been the prescription opioid crisis. It is the new part of the opioid crisis.
Okay. There was another question that I thought was very interesting. As someone who lost their 27-year-old daughter to fentanyl poisoning, and our hearts go out to you, I would like to know what we can do to hold those responsible for all these deaths. We know our government has failed us by not giving the resources to those in power, and thus far enacting a law making these cartel terrorists so we can go after them where they stand. as far as I'm concerned, this is a war crime, and those who could have saved hundreds of thousands of lives are complicit in their murder. So, I mean, we don't have to come, but what is the federal government really going after the cartels?
Yeah, I mean, one thing, if I could say, David, I'm sort of like guy who comes in. I do a lot of research. I try to like build up and just tell, as you know, in the book, a factual story. And then I ended up meeting one mother who had lost her daughter in the book. I write about her, Marianne Skolick. She's in a chapter. You messed with the wrong mother. But I've met parents since then: Ed Bish, April Babcock, Dan Schneider, Cynthia Munger. Son survived, thank goodness. So many mothers and fathers who lost children. And here you have somebody who's lost a 27-year-old daughter to fentanyl. These are the stories that take me out of just the facts and the story of what happened, because they are such powerfully emotional stories, and they are like they are left as survivors but wounded in many ways, looking for an answer. They've had a child that died from, many of them, from the overprescribing of OxyContin and other opioids, and it wasn't stopped. And now they see fentanyl flooding the streets, and if they lose children to that, it looks as though the federal government isn't doing anything. And I must say that although I've spoken to the DEA, the DEA would like to be more aggressive, but they don't have a national mandate to go ahead and do it. There has been talk, I know, by many of the activists that declare the Mexican cartels a terrorist organization, and then you can go after them as you did Al Qaeda or that. But there's no appetite on either side of the aisle, unfortunately, except for a few people in Congress, but very little appetite to go ahead and actually try to pick a fight with a terrorist organization that's probably very well armed in Mexico, in our southern neighbor. There's very little appetite for that, unfortunately. And I don't think that there is an immediate answer. There's been surprisingly little focus on fentanyl from the federal level. And I just end with this. I think that a lot of people that I've spoken to who are parents would, not that they would feel better, but they'd like to see an ongoing effort where federal officials and in the White House and President Biden and others said fentanyl is at a crisis and we're going to go after it. Even if they made very little headway, the fact that they were talking about it and on it and doing something would at least make them feel something. They don't see any of that taking place. And I missed the march on Washington that was had by this year on lost voices of fentanyl. I wish I had been there, but they're calling on Washington, both sides of the aisle, to try to step up and take a position and advocate on making progress.
I was also surprised to learn that it's really not only a city crisis. I've spoken to some in New Hampshire and said that they have some of the worst statistics. I mean, it's a rural crisis as well.
Wow. Isn't that amazing, though, to think that so is OxyContin. OxyContin didn't start as a Philadelphia, New York City, San Francisco, Los Angeles problem. It started out in Appalachia. Beth Macy in her great book, Dopesick, traces it so well, talks to the people and the families. And it wasn't by accident. It wasn't as though Purdue and the Sackler said, oh, by the way, where will we start selling this drug? I guess the first trains, shipments are stopping, down in Appalachia. They went for an area in which the people, they knew there was a hardworking, sort of working class group of people who had jobs that required a lot of manual labor, who suffered pain, and they thought they could sell to them, and they did it very successfully.
Yeah, they show that in Dopesick and how the pharmaceutical reps went and they zeroed in on doctors. And I was thinking possibly because there's a little more scrutiny in the larger cities, possibly. Someone else says FDA review and approve of OxyContin came without titration limits and ultimately allowed its widespread use for mild to moderate pain. And then they talked about certain FDA staff were promptly hired by Purdue upon approval of OxyContin. So do you feel that adequate reforms have been made at the FDA to ensure that this implied corruption could not happen again? And if not, what can be done?
Yeah, so the answer is, the FDA, boy, I'll tell you, especially with prescription opioids and with Purdue, they were just outmatched time and time again. They just were outflanked. They weren't capable of staying abreast of what the latest changes were. They were reticent to make them. Inside, I disclosed in my book a 45-page PowerPoint that had been given by the DEA for the first time to the FDA back in 2001, saying we've got to do something about OxyContin because it's a problem. It's being diverted to the street, and the FDA ignored it and buried it in the back. Not because they were getting a payoff from Purdue, but just because they didn't see it that way. They didn't have the staffing to do it. And it makes everybody in the lay public suspicious when they see someone like Curtis Wright, who is the medical officer at the FDA, who gave approval to OxyContin with some language that was unprecedented at the time, including the fact that it probably had a low incidence of addiction if used just properly for pain. There was no science to back that up. That it was less likely that an extended release formula would be subject to abuse. There was no science to back that up. It just seemed logical to them. And then 2 years after he gives the approval, he goes over and works at Purdue for $400,000 a year, about 5 times then his salary at the FDA. Now, has that been reformed? No, that happens at every federal agency. As you know, people leave to go to work for the corporations that they used to regulate at some point, often for much higher money, but it doesn't sit well, unfortunately, with a lot of people.
Yeah. So someone said, I would ask that the term street fentanyl be used. The prescribed fentanyl patch helped my 92-year-old father tremendously at a particular point in his dying process. I can agree with that.
So. I think that's absolutely right. And as a matter of fact, I don't know, the point is you will talk to patients who have chronic pain, legitimately receive pain relievers, opioid pain relievers, and they will tell you that they feel like a criminal when they go into a pharmacy. If it's not the regular pharmacy in a pharmacy they know, if they're in some other city or they're traveling or they've just moved, they go to a new pharmacy with an OxyContin or a Percocet prescription. Sometimes they're told, no, there's no supply of it here. They feel as though the entire epidemic has sort of tar and feathered those who need a prescription. And one thing I do think is that, the response to this epidemic, as it is with fentanyl, was slow by the government, terribly slow and negligently so. And why? Because there is a feeling by some public officials and people serving in government, they're addicts. It's addicts. It's not true. The people were prescribed this by doctors for legitimate reasons and developed, unfortunately, because of prescribing habits that were misleading, and they were sold by companies like Purdue too much. They got addicted. They developed problems. But I think that in some ways that unfortunately kept a government response from happening sooner.
So someone has asked, why aren't the Sacklers in jail?
From your mouth to God's ears.
They're rich. They're rich.
Yeah, but you can be rich. Leona Helmsley was rich and still went away for a little bit. Martha Stewart was rich and still went away for a little bit. So you can be rich and still end up, and Sam Bankman-Fried may end up behind bars, and so did Bernie Madoff. So my point is that why not the Sacklers? I am still hopeful that the Department of Justice, somebody in the Department of Justice, will pick this case up. We now know there was a 120-page memorandum that was kept secret for years and years, 6 pages of which I published a couple of years ago. The Guardian published as well. That goes back to a 2007 criminal case brought against Purdue by John Brownlee, who was a federal prosecutor. And it ended up being a case for, misbranding the drug and deceptive advertisement. So Purdue paid a $600 million fine, and 3 executives paid $35 million. But now we know, David, that what the Justice Department had to consider was John Brownlee, the prosecutor, after spending a couple of years on this, said we should be bringing criminal charges against the Sacklers themselves, against the leaders of this, and against the company for money laundering, for wire fraud, and for conspiracy. And he set out the case. And the Justice Department, with Rudy Giuliani coming in and sort of, using all of he was working for Purdue at the time. It was one of his first clients when he did a private practice. They didn't have the guts for it. They said, no, you know what? It's low-hanging fruit. Let's just go for the $600 million fine and the criminal charge, it'll be fine. Let's not go for criminal charges against the owners of the company. And that was a big mistake because they came back, they meaning the Sacklers, and they made more money, sold more OxyContin, and did more outrageous things, notwithstanding the corporate compliance agreement that they had to sign in 2007 than any other time. With the $35 billion they made in OxyContin since its release, they made $20 billion of that after the company pled guilty in 2007. So those charges should have been brought back then. They weren't. And why they aren't brought now is because no prosecutor at any state level, no attorney general, and no one in the Justice Department wants to take on a case that will be tough. Sacklers can buy a great defense, and they don't want to lose that case. That's unfortunate because they're going to let them walk. And I think that's the wrong message here. But I'm not sitting there as a prosecutor, so I can't make a decision.
Okay. Do you know someone named Dan, the pharmacist Schneider? He has a question. How does MAT fit in? I'm not sure what MAT is. Recently, Congress passed a bipartisan mental health bill, including the MAT and MAT acts to encourage mainstreaming MAT. Could you first explain what MAT is?
Yeah, maintenance addiction therapy, sort of the use of drugs that are sometimes used now, to be able to, it's the equivalent of what had been done years ago, but in a much more sophisticated way for methadone and heroin. So you can take people off of opioid addictions to drugs that will not be nearly as long-term damaging. And there's a good debate that takes place about this. And Dan, the pharmacist Schneider, who you just referenced, you and many other people may have seen his absolutely riveting segment that was on Netflix. I think it was that part of the program. It was the one called The Pharmacist. And he talks about the loss of his son and how he single-handedly went after the people responsible for that. I have a lot of respect for him. We have a little bit of disagreement about how he wants the rollout for MAT to be now in every city. And I say it's possibly safer maintenance addiction. But I also know that in places like San Francisco or in Vancouver, where they've had very open, needle exchange programs and the equivalent of MAT programs, they have drug dealing taking place outside of the actual centers. And that's a problem. They're not doing anything about it. In places like Portugal, where they have MAT and drugs are actually legalized, if you're caught shooting up on the street or somebody selling a drug on the street, they will take you to prison. So we have to find out what we want to do in this country. Do we want to, roll out MAT and have centers where people can be safe and not overdose when they use opioids, but at the same time crack down on the external selling of drugs? You can't have it both ways. So I think that has to be done at the federal level, and I don't see any move to that at the federal level, unfortunately.
Are the pharmaceutical industry developing drugs that are not as addictive for pain?
The holy grail of the pharmaceutical industry is to come up with, what's the number one complaint that people have as a symptom? Yes, cancer therapies and drugs are very, very expensive. They may make more money as a group if you put them all together. But the biggest complaint that people have is pain. Everybody seems to, a third of the country or that complains at some level about pain. And so the true holy grail would be the equivalent of something that would block pain or make it better without being addictive. And that's one of the reasons. Look, the Sackler family in Purdue, they were smart. Nobody ever accused them of not being smart, clever and diabolical in how smart they were. They understood that. And that's why they try to sell OxyContin through their sales reps as having less than a 2% chance of addiction. And too many doctors believed it because it was based upon this sort of false science and a 5-sentence letter sent to JAMA in 1980, in which a doctor and a graduate student wrote a letter saying, by the way, we reviewed 40,000 cases at Boston University Hospital, and 12,000 of those cases of people hospitalized were given one or more opioid pain relief medication while they were in the hospital, and only 4 of those developed an addiction problem. Well, that's fantastic, David, except that letter was a letter to the editors, so there was no peer review. Nobody went back to it. What nobody mentioned afterwards is, by the way, that was in the hospital setting. When those people left the hospital, most of them were not prescribed opioids. Were the 4 people who had an addiction problem already addicts beforehand and were given an opioid for a surgery inside the hospital? We don't know. But what we do know is that that letter was cited time and time again in the lay press and the scientific press. And the Sacklers used it very effectively to say, look, the chances of getting addicted to opioid, it's proven in this large study, are minuscule. And so they knew what they had to say. Pain relief, no risk of addiction.
And the doctors who wrote that letter said he was not aware that it was being cited. He had no idea.
He was sort of horrified.
Yeah, it was cited thousands and thousands of times.
And what's interesting is that by the time it's cited in Newsweek or Time or The Atlantic or somewhere else, the writer, after 10 or 15 years, doesn't go back to the original thing and sees it and cites it as a study. So it's repeated, 600 times, I think I have it cited in the lay press or in scientific journals, often as a study, an important landmark study, things like this. It's a 5-sentence letter, and look, there was another thing aside from that, legitimately so, starting in the mid 80s, and any doctor went to medical school then will tell you, there was a reevaluation movement about opioids, some from pain management, the new field of pain management, and some people in oncology at Sloan Kettering were talking about it. And I've got here, there's all types of things. There's a book put out, Pain Management, Theory and Practice, by Russell Portnoy. He was one of the leading doctors at the time. That book's published the same year that OxyContin comes out. And these doctors were the ones who started the movement that said, by the way, pain should be the 5th vital sign. So you go to the doctor, you get your blood pressure checked, you get your pulse, right? They ask you all those things, fever, if you have a temperature, make pain a standalone diagnosis. Don't look at it as being caused by something else going on in the body. Somebody says they have pain, you should treat it. And treating it means treating it with opioids, because opioids have been tarred and feathered for far too long. Now, these doctors were not paid by drug companies. There were no products then. There was no OxyContin for another 10 years. But once OxyContin and the other drugs started to be sold in big numbers, those companies went ahead and took those doctors and sort of compromised their work and then enveloped it. They made them part of speakers bureaus. They gave them money to travel around and speak to schools. They meaning Purdue and others, created curricula at leading medical schools like at Tufts and at Harvard to teach pain management, which meant more aggressive treatment with opioids. So what started out as a reanalysis of opioids later become part of the underlying fake science, because it turned out to be wrong. The doctors weren't fake about it initially, they just were wrong. And they later, I think some of them admitted it, but it was used by Purdue and others to sell product.
Well, I went to congressional hearings when I worked at the American Cancer Society and Cancer Care, and there were patients who testified that their pains were ignored. I mean, the National Cancer Institute was started years ago. I forget the congressman, very famous congressman, I can't recall, but his wife had terrible pain, but she was screaming all night. But Congressman Pepper, he said,
Claude Pepper.
Claude Pepper, but he said that he didn't know, because when he went to visit, she didn't scream. But the cancer patients, legitimately felt they were not, they were being not treated, or not adequately treated for pain control. And that's kind of what led to being pain the fifth sign.
That's right. And I think, this as well. People don't realize it for the most part, but the whole discovery of a long-acting time-release opioid pain medication came up as a result of a search started by Cicely Saunders, who was a nurse turned practitioner in England, who had the idea of establishing hospice. She did establish the first hospice, St. Christopher's, in 1966 in London. But she said, what's keeping me from sending these end-of-life terminal cancer patients home so they can be with their loved ones instead of being in a hospital to die is that we have to administer, often IV, pain relief every 4 hours. So her holy grail was to find a long-acting pain relief that she could administer maybe twice a day and send them home. That would be effective hospice. And the company that came up with that, lo and behold, about a decade after she started looking for it, was a British company called Pharmaceuticals. Who owned it? The Sackler family. So the British pharmaceutical company owned by the Sacklers come up with a drug called MS Continuous, later marketed as MS Contin in the States. And it's the first long-acting opioid painkiller. It's morphine, wrapped around morphine, as opposed to oxycodone, which is what OxyContin was. So that becomes the basis for the Sacklers understanding that invisible polymer, slow, 12-hour release formula they used on morphine to make hospice work, how they could use it later on a much bigger seller to more people for oxycodone.
Well, I was in this week, one government body was saying that the first choice in treating depression should not be SSRIs, but should be cognitive therapy and or the second tier drugs, such as tofranil, because now they recognize that SSRIs lead to suicidal ideation and all other kinds of problems. I mean, 1980s, there were people saying you should throw Prozac in the water. It's not harmful.
That's exactly right. And the great thing is, the and the drug companies, for the most part, and the pharmaceutical companies, they enjoy the years of booming sales. SSRIs were some of the top selling drugs in the 80s in the US, and looked as though they were a panacea for depression. And you're absolutely right. But you come in 40 years later with the caveat that maybe cognitive therapy is the first step as opposed to going right to the pharmaceutical solution. But they aren't suffering. They're all off of patent. They've run 15, 17 years, 20 years on everything from Prozac on, and they've had a very, very successful run.
Yeah, and there's also alternatives like transcranial magnetic stimulation, but also in pain management. I've had pain. I've never taken an opioid, but I had radio frequency ablation, where they kill the nerve. In my case, it was effective. Not everyone, of course, but pain management is a very big industry in America. And there seems to be a need for it. I mean, it's partly the aging population. I mean, people are going to physical therapy because people need physical therapy.
No question about it. I agree with you. And so pain management, legitimate industry, but what I would say, and I'm going to guess at the percentage, I'm not sure, but I know that the vast majority, when OxyContin was booming, they weren't being given out for pain management. We know this, that less than 5% of the prescribers prescribed about 80% of all the drugs when it was coming to Oxy. There was a time in Florida when Broward County, when they had pill mills before they were closed around 2012, 2013, over 85% of the entire supply in the United States was coming from 7 clinics in Broward County. So those were essentially, they were the equivalent of legal drug clinics. They were illegal, but they had a legality to them because a doctor ran them and then was supposedly writing prescriptions for the maximum amount as fast as possible. And people were using them for getting high. They were using them to sell on the street. They were diverting them. And unfortunately, what starts out as a legitimate pain reliever for those who really need it then becomes, when you have the equivalent of those pill mills taking place. That's what Dan Schneider and the pharmacist on Netflix was chasing, was a pill mill operator who was operating near him near New Orleans in Baton Rouge. They destroyed the entire system. And that's why I always say, we talk about the Sacklers and OxyContin and Purdue a lot, but they aren't the only ones to blame. I castigate the FDA sometimes for not doing everything it could, but at the same time, the big distributors, Amerisource, Bergen, Cardinal Health, these CVS's brand, they knew where every pill in the country was going. They baked multi-billion-dollar settlements recently. They never reported any of it to the FDA. There were overprescribing doctors. Some of them have lost their licenses. Some even went to prison. But doctors were prescribing some, far too much. The big national chain realtors, they've also paid billions of dollars in settlements, and that includes everyone from Dwayne Reed to CVS to Walgreens. They were filling fake prescriptions that looked like a 3-year-old had written them, and winking and nodding to each other just to be able to sell more pills in some instances. And so now they're paying the price for it. There are a lot of different responsible hands on this, unfortunately. So it's not as though it was just, I think sometimes the Sacklers, as I said before, they started the fire and they seem very, very culpable. They are also private owners of a private company. So we identify them. We know who they are. the big companies like Johnson and Johnson and others, Teva, who have had to pay multi-billion-dollar settlements. The average person on the street can't name who their CEO is, much less who's on the board or whatever else. They're not identifiable to a face, but you can put a face to Purdue, and it's the Sacklers. And I think they deserve a lot of the blame, but it's also why they get a lot, because they are so easily identifiable.
So it says the opioids is a strain in the economy, but also considered a threat to national security. It costs the country tens of billions of dollars annually in healthcare expenses, but also in the form of a weakened workforce. So as you know, the United States has reached its credit limit today. So they have to, Janet Yellen saying we're going to have to do strategic cuts, not to, default. Tens of billions of dollars is something I would think it'd be worth Congress doing something about. And you said there's no appetite for that.
The reason I think there's no appetite for it is nobody has a simple answer. And you can't just say all the time, we're going to fix it and then not do something about it. And it's unfortunate because there were ways to control the opioid crisis when it was prescription, but that got out of the way. And the unfortunate thing here is that, Congress had hearings in which they had called, they called on people from Purdue, and they had hearings a couple of years ago on OxyContin and the opioid crisis. But I think what a lot of people were hoping is that they would press to make sure that, I'll give you one small example. If you can't stop the crisis and save the tens of billions of dollars in lost productivity, then let's go ahead and find the people who are responsible and hold them accountable. And when Purdue Pharma filed bankruptcy, it became a game with the lawyers just of money. What can we give for money to all the states so they can go ahead and offset some of their costs in treating addicts, as opposed to accountability? And the worst part of this, David, is we're speaking right now, it's 7 months since the Judge Drain, in the bankruptcy proceeding in New York, approved the bankruptcy plan that was put forward, which included $5 billion from the Sackler family. They still don't feel sorry for them. They left with billions more of OxyContin profits. But the thing is, 7 months since the Second Circuit has had the question of whether that's legitimate. Should the Sacklers be excused from any and all civil actions, even those alleging misconduct or willful conduct or fraud, although they did not declare bankruptcy, and they had a lot of money because they tagged on to the bankruptcy of Purdue? And this arises from R.H. Robbins, which you'll remember, who had the IUD, which caused the company to go bankrupt back in the 70s. And the Robbins family did the same thing. They went ahead and they became sort of parties in the bankruptcy. They put a lot of money toward it, and the judge excused them from all litigation, even though they hadn't gone bankrupt. Now the Sacklers are the extreme example of it. So if we can't solve the issue of the lost productivity, I'm hoping we can solve a smaller issue. The Second Circuit will say the Sacklers can't be relieved of all their responsibility. Maybe we can get some accountability eventually for what happened in this crisis.
What's happening worldwide? I mean, is pain considered a vital sign in European countries and Asian countries? And
Yes.
what are their approaches to pain?
Yeah. I originally thought that I was going to go out and find out that each country, the UK, France, Spain, in Asia as well, countries had a similar type of excessive opioid addiction prescription problem that we had here in the US. And the answer is no. They all had, not for lack of trying. In 2010, Purdue launched an entire effort to try to go worldwide. They sort of took a chapter of what I call the old tobacco manual, which is you're under attack in the US, you're starting to get attacked too much here, 2013, 14. So you know what? You don't give up, you just go abroad and you start to sell your product there. What kept those countries free from getting as endemic a problem as we have here is they have limits on the amount of the prescriptions that are in place, not because they were savvy to the potential fallout from addiction, but because they have cost controls that are very, very tight on what their governments will pay for. So in the UK, which is a one-payer government-paid system, there are limits on how much a doctor can prescribe for opioids. You can't become a pill mill. the National Health Service will close you down. It just doesn't happen. You can't have 5% of the doctors prescribing 80% of the medication. The same in Spain and the national, in Germany and other places. The limitations put on for cost were really the limitations that ended up controlling it from becoming an epidemic.
So I remember in Dopesick, one of the Sacklers wanted to bring it to Germany, and they said, "There's no way you're going to do that."
No, as a matter of fact, and they tried repeatedly to do so, but they were unable to. The best thing they did, and best I mean for the Sacklers, using all their foreign corporations, was they had a Swiss company held the patent rights to what was OxyContin, and the British company that manufactured it for the rest of Europe shipped it to Bermuda, where they had a subsidiary. And Bermuda corporations don't pay any tax on as a result of products that they manufacture in Bermuda. So then it would be shipped from Bermuda to the rest of the world. Well, guess what? England found out that the UK company never shipped it to Bermuda. They just did that on paper. They avoided about $1 billion in taxes over the years. And the British Parliament changed their law as a result of the Sacklers' misuse of it. It wasn't illegal, it was just very clever. So, they were always looking for a way to wring the last dollar out of it or sell the last bit of opioids abroad.
So why don't you tell us about the Showtime series and about your book?
Anybody who writes for a living, any of us who have had books put out, I'm sure that many have had a book optioned by somebody, and then it sits there. And the first time that happens, you think it's going to become a movie in the next 6 months, and then you realize the chance of that happening is very small, sort of like buying a lottery ticket and hoping you win mega lottery. So in this case, Pharma was bought 2 years ago, the rights to it, by R.J. Cutler. He's a great documentarian. Some of you will know that he did his first breakthrough film, I think it was The War Room with the Clintons, where he was inside the campaign, Stephanopoulos and Carville and everybody else when they were running for president the first time. He's taken it, developed a great 6-episode show that's on drugs, so that one's on antibiotics, one is on the pill, one is on benzos and sort of like tranquilizers, one's on AIDS, one is on opioids, and then one's on COVID and the vaccines. And Showtime took it. They're closing it right now in final production, and it'll be on later this year. So that will be great to see that happen. And I had the great pleasure, by the way, you had mentioned before, of working as a consultant on Beth Macy's book, Dopesick, when it was made into a series for Hulu. Not only was that one of my favorite books in years, Beth Macy's a fantastic journalist, and she's a great writer, but being asked to be a consultant on that turned out to be an extra pleasure, because Danny Strong, who created it, he was the showrunner who put it together and was involved in each and every aspect. He turned out, and I wouldn't know this because I had never dealt with him before, to be one of these guys obsessed with details and getting it right. And he would just keep coming back time and time again and say, what about this? Is there anything else? Can you do more reporting on that? Do we have that right? Cross this T, dot that I. So even though it's a scripted series, it's very accurate. And those who have seen it and lived it know that as well. And it was a pleasure to be a part of that.
Man, it was really great. So what are you working on now?
Now I'm really trying to finish up this project for Showtime, but I have a project in the works on what I call the politics of cancer, probably as a documentary. I may be coming back to you at some point, since you've done a little bit of writing about that.
Okay, so someone said, okay, so I want to give other people a chance who haven't asked questions. So much of pain research is based on poorly designed studies or outright anecdotal evidence. Those in favor of more opioid restrictions and those against more restrictions have their set of studies to reference. And most of these studies are anecdotal, correlative in nature. Why does the field of pain management struggle with such poorly designed studies?
Wow, I mean, the very nature, the question in some ways, provides the answer for it, which is we don't have a good measurement. We don't have a blood pressure reader. We don't have a glucose test. We don't have something that's going to give us that idea right off the bat. It's not like we're looking for diabetes and we know what the number should be on sugar and what's your A1C. And if your cholesterol is too high, maybe these numbers are something to worry about. We're dealing with something that is subjective. They ask you the question 1 to 10 on a pain scale. People who don't know what the pain scale is may say 10. They don't realize that 10, if you actually look at the original description, is the equivalent of your fingers being crushed underneath, a car wheel driving over to that. It's a very high level.
Pain scales don't work for children.
Yeah, and for children, not at all. So they tried the smiley faces for children for a while. Which one looks the most like how you feel today? And so it is subjective, and some people have a very high tolerance for pain and say, "Oh, I'm all right today," or "I feel a little bit better," whereas somebody else with the same level of pain would be screaming and saying it's not enough. So I think that we're unfortunately it's hard to measure, and you're right. It's not just a question of measuring it. It's also a question of figuring out what the side effect is. And I don't mean the side effect in terms of headache, nausea, weight gain, hair loss, whatever you want to say. Talking about side effects that could make somebody addicted or in a significant enough dose lead to death because it's a respiratory suppressant. And you know this, David, when the DEA tried to make their case that OxyContin was dangerous in 2001, what the Purdue said is, oh, look at all of your autopsies you have from medical examiners around the country. It's not just OxyContin. It's OxyContin mixed with other things, sometimes benzos, sometimes cannabis, sometimes there'd be a little bit of speed or methamphetamine or a little bit of heroin. That's right. Sometimes people die just from an OxyContin overdose, but often if they're using it for recreational purposes, they're mixing it with alcohol and other things, they all suppress the respiration. And so I think for a long time, the manufacturers avoided blame because they were able to say, look, we're just part of the problem. We aren't the problem.
Someone asked, what can I do as a citizen to help convince Congress to address the revolving door between the FDA and pharmaceutical companies?
I do think that letters from constituents to their Congress people do help. I know that's going to make a lot of people listen to that think that I'm absolutely a dinosaur or I'm naive or something, and it doesn't happen. They only respond to things with a lot of money. But I'll tell you why that is. I've seen it work before. I know that I've written myself without knowing the office that it landed on about a young Afghan interpreter who had helped American special forces and was not getting ahead at all in his process to get a special visa to come to the US at a time when his life would have been in danger with the Taliban. That office moved to be able to move his application along because that letter just landed on the right desk. And if you get them a campaign, what I mean by that is they respond less, believe it or not, to a campaign that's been organized sometimes by the American Red Cross, the American Cancer Society, in which they give you a form to sign, send it to Congress people now, AARP, and they get 4,000 of them because they know that's just being motivated by the large nonprofit. If people take the time to actually write an individual email to the office saying, I'm really concerned about the fact that with OxyContin, the person who approved it was able to go to the, to Purdue. And why hasn't that been closed as a general item? It just takes one congressperson to get going and to light the fire on them. So I say, send those messages in. They can help.
They also have citizen committees that people can join.
That's right. And the thing is, you always have to get what I call the zeitgeist, the moment. What on the citizen committees tends to be the dominating issues that everybody seems to be riled up about, and then you have to insert that. But the citizen committees can be very good.
I also want to say that I've worked for Pfizer for 10 years. I think that I don't regret it at all. I worked with a lot of dedicated people. I worked on the launch of Zoloft and Diflucan, which was a drug that was an antifungal drug for basically AIDS patients, and then later cancer patients, and who had no alternative, or the alternative was terrible. So I worked with a lot of people who were very dedicated, very honest, concerned about people. So I think the people like the Sacklers, yes, they want to make money. Everybody wants to make money. But I just think that to blame it totally on them is not true, because they're not having anything to do with the Mexican cartels and things like that. So we have a vaccine against COVID.
Yeah, look, I've always thought one of the few things I disagreed with my publisher on, my otherwise excellent, very smart publisher, Avid Reader Press, imprint of Simon & Schuster. The only thing I disagreed with was the subtitle of my book, Greed, Lies, and the Poisoning of America. I said, that's one part of the pharma story. Okay, that's the Sackler part, and we're focusing a lot on opioids in the book. But there is a lot of innovation and great things happening in the pharmaceutical industry. Not all there, that's the yin and yang of it. The great thing is that there are some dedicated researchers and scientists inside the lab who are coming up with breakthroughs that at times are cures and other times are fantastic therapies. The penicillin changed the world in many ways, and one is I put it on my handful of top 5 human discoveries. But there are also instances in which that great discovery then goes over to the marketing department, and they get a little overzealous with it. And when it involves something that's potentially deadly or addictive, nothing worse than an addictive product, ask the tobacco people, then it becomes a bad story. So I think that often we are left with, tonight we're talking about opiates, so it's a bad part of the story, but there's no question that the pharmaceutical industry is much richer than that. And I often try to talk about that, whether we're talking about from the time that we're doing polio vaccines and coming up with other items. So there are plenty of bad stories. The bad stories are the ones people tend to remember. And there is little doubt, I think, that the Sacklers were a black eye for pharma. In general, the COVID vaccines have restored a lot of credibility to pharma in a different way.
So I have one more question I'm going to ask, and that is that have the museums and other charities accepted donations from the Sackler family? As you know, there's New York City, there's Sackler wings. And have they done enough to absolve themselves of moral responsibility to the Sacklers' misconduct? I don't know. Has their name been taken off everything or not? Not everything.
It has largely come off just about everything at this stage. There was a time in which the widow, the second wife of Arthur Sackler, who died in 1987, so 9 years before OxyContin came out. He was the oldest of the 3 Sackler brothers. She made an effort to say, don't take his name off. His is on the Smithsonian, his is at Harvard, and his is really the one at Tufts. And don't take that off because he's the one at the Serpentine, because he wasn't around for OxyContin. But the sort of push against the Sacklers was too great for everything. And he was the one who sort of taught his younger brothers how to do the hard sell, because he revolutionized advertising inside the drug industry. I do think that in some ways Nan Goldin, the artist, a great documentary about her now, she's the one who went to places, and would throw the prescriptions down from the 2nd floor, lay down outside the museums and show the bodies that were adding up. Took activists, citizen activists, to be able to get the attention on the Sacklers. And I think that it did come on the Sacklers. They made a lot of money from OxyContin. They gave a lot away for philanthropy with their name on it, no question about it. It went to some very good causes, and then they used a lot for their personal wealth. I remember when Ivan Boesky, the great Wall Street trader who was charged in a fraud in a criminal trial, there were philanthropics all around New York City that were crestfallen when he was indicted because he stole a lot of money, but he gave a lot away as well. And the Sacklers were big philanthropists, notwithstanding their source of money.
Yeah. Well, I mean, the Tisch family, they made all their money from Lorillard cigarettes, and they wanted Memorial Sloan Kettering to rename themselves, Tisch, and they didn't. But the NYU Tisch Hospital is NYU. So
that's very interesting. I didn't know that they had first wanted Memorial Sloan Kettering. That's interesting.
Well, so anyway, before we go, I just want to tell what's coming up. Here's a book called We the Scientists. It's by Amy Doxer Marcus, and it's how a daring team of patients and doctors forged a new path for medicine. I think I'm speaking to her in 2 weeks from today. And then here's another book. This is by Nita Farahani. It's called The Battle for Your Brain, Defending the Right to Think Freely in the Age of Neurotechnology. This book is coming out in March, so I'll be speaking to her in March. So we have that upcoming. And we're also going to talk about wastewater, which has been, a lot of COVID has been discovered in wastewater, and it's used in, to gauge what's going on in schools and prisons where people don't necessarily want to give samples. So they get a lot, and they also were able to determine that the COVID in the West Coast came from China, and the COVID in the East Coast came from Europe. So I think that'll be an interesting talk. I haven't set the date for that. So I want to thank Gerald. Do you have a copy of your book, Pharma?
You know, I don't have it right here next to me somewhere. Yeah,
It's a
David,
big,
let me ask you a question, by the way,
yeah.
do you have already on the program, did I miss it, Mikhail Sakaris? He's an oncologist who's written a book called The FDA and Drugs. It's a new book out. I
Uh,
had the pleasure of doing a conversation with him at the university. He's University of Miami oncologist, and he's excellent. And I did a conversation with him at the Miami Book Fair, and he's got a super book, very readable. And from the perspective, he was on the committee that had to make these major decisions on big oncology drugs, and he talks about the process and that. I think you and your science writers would find it very interesting.
Can you send me his information?
I will.
Okay.
Here, Trisha.
Oh.
Trisha gave me. This is the best part. Trisha gave me the cover, but not the book. I don't know how that happened, but all right. Anyway, there's a book in there for most people.
Yeah, it's a great book, and soon coming to a screen near you. Okay, I want to thank everyone for taking their time in January to spend some time with us. Gerald, always great to see you, and
Great to see you.
hope to see you when I come to Florida.
I look forward to it. Thanks, David, so much.
Okay.
Thanks, Joe.
Take care, everyone. Good night and stay safe out there. Bye-bye.